Hello, everyone. Thank you for joining us this evening. In February, Empowered to Serve launched Empowered Women, a four-part series to have an open and honest dialogue with women of color around key issues that impact their cardiovascular and mental health, with an eye toward providing resources for improved, sustainable outcomes. Now we turn to addressing the needs of men of color. Men of color experience poor health outcomes and shorter lifespans, due in large measure to disparities in the social and economic drivers of health or social determinants of health. Research has shown that many of the conditions leading to premature mortality are preventable. However, the solutions that are implemented to counteract these health outcomes often result in temporary rather than sustainable change. Men maintain strong voices in their communities, and we must engage them in the dialogue about long-term solutions. Tonight, we will focus our discussion on how the COVID-19 pandemic, social and racial justice issues, and the tragic events experienced by communities of color over the last year, including these recent few weeks, impact the mental and cardiovascular health of men of color. To get us started, our CEO, Nancy Brown, is here to welcome you and share why the American Heart Association connected the dots between a person's heart health and the disparities and social determinants of the environment in which he lives. Nancy, welcome.
Hi, Daryl. Thank you so much. And good evening, everyone. I'm Nancy Brown. I am the CEO of the American Heart Association. And as Daryl said, tonight you will hear from thought leaders about the mental and cardiovascular health of men of color. This topic is so relevant, especially as we emerge from the pandemic. Historically, people of color, including Black, Hispanics, and Latinx people, have higher risk of cardiovascular disease, largely due to social factors. As you probably know, cardiovascular disease is the #1 cause of death for Americans, but did you know that 44% of adult Black men have some form of heart disease? They are also at higher risk for serious conditions related to cardiovascular disease, as 15% are diabetic, 30% are pre-diabetic, and 60% have high blood pressure. Couple this with the fact that people in the United States are more stressed than ever, grappling with the effects and uncertainties of COVID-19 in our personal and professional lives. Although more Americans are getting vaccinated, the mental exhaustion toll continues, specifically for Black, Hispanic, Latino, Asian, and Native men. For decades, the American Heart Association has championed health equity, leveraging our voice, our platform, and our resources to dismantle barriers like social determinants of health, structural racism, and rural health challenges that prevent people from living full, healthy lives. Taking control of one at the heart of tonight's discussion. Thank you for joining us. It's going to be a robust and enriching evening. Daryl, I will now turn it back to you.
Thank you, Nancy. Before I introduce our moderator and panel for the evening, we want to welcome Ray Newsom, a member of the Xerox Alliance with the American Heart Association, to share his story on the importance of prioritizing your health. Welcome, Ray.
Thank you, Daryl. Good evening. Ray Newsom. I'm located in the San Francisco Bay Area. 2017 was a very challenging year. In fact, it was the most challenging year of my life. I was the victim of a hate crime. It was a private Instagram account that I was depicted with some really racial pictures that got spread around to the community. And so it was a very, very stressful, difficult time for me and my family during that time, as we had to deal with the fallout of that account. So I'm going to fast forward to the summer of 2017, after dealing with that very stressful situation. I was doing my yearly physical exam. I was pretty good about doing that every year. I would do my physical exam to get everything tested, my cholesterol, things like that. One of the tests that I also did was getting a prostate exam. And we know prostate exam is a pretty divisive test in the Black community, as far as men not wanting to have that test just because of the physical of it. But I thought it was always very important. And there's also a blood test that goes along with that. The blood test came back with the PSA result. And PSA is really what describes what the possibility of cancer could be in your prostate. And those numbers were just slightly higher than normal. The doctor didn't seem concerned. He just said, well, let's do another test just to be sure. So we took a secondary test and those numbers ticked up even a little bit higher. So we said, let's be safe and let's have you see a urologist. We did another test with him. We actually, we did a biopsy and it came back that I did have prostate cancer. Now, you can imagine, obviously I've heard a little bit about prostate cancer. I've heard about the devastating effects it's had on Black men. And I immediately, was scared, was concerned. But the good news is my doctor explained to me that it was an early detection. And the fact that I was getting tests yearly really gave me an opportunity to be able to fight this. And obviously I did the treatment, had surgery, everything came out great. I do tests every 6 months now, just to make sure that my numbers are clean and things are great and fantastic. But the correlation I wanted to add is that, again, I had a very stressful event that happened in my life. And, I'm sure there's lots of studies on stress and how does it affect the human body. And did that event really cause me to have an issue in my immune system? I don't know. Everybody in my family will tell you yes. But the important thing was I was getting tested and I got an early detection and I was able to take care of it and really probably save my life. So again, my message for everyone, find ways to kind of, de-stress when you get into these type of stressful situations and continue to get your yearly checkups. Don't be afraid of the prostate exam. You don't have to have the physical part of it. The most important piece is to get the blood test. And when you get that, that will give you the results that you need. So thank you, Daryl.
Ray, thank you so much. And what a powerful testimony. We really appreciate you for sharing it. As you heard, we have convened a powerful group of voices to share their personal stories and expert thoughts with us this evening. Our moderator, Dr. Brahma Sharma, was born in India and completed his MD at the University of Rajasthan in Jaipur, India. He migrated to the United States and did his residency in internal medicine at the University of Alabama at Birmingham, which is actually my wife's hometown. Dr. Sharma holds Baptist Medical Center very dear to his heart and has an affinity for ethnic health. He is active in many diverse medical organizations, such as the Association of Physicians of Indian Origin. He is chair of the American Heart Association Asian American Pacific Islander Liaison Committee for Cardiovascular Disease and Sudden Death and Prevention, and is an active member of the Indian Cardiac Resuscitation Council, which promotes CPR and ACLS in rural India. Author, professor, lecturer, public speaker, entrepreneur, music executive, artist manager, fighter, and survivor would be the words used to sum up the life and career of Dr. Matthew Knowles. He is widely recognized in the entertainment industry for his effective approach in developing and promoting award-winning artists, and he has garnered countless awards for his achievements in business, the music industry, philanthropy, and community partnerships. Dr. Knowles is a cancer survivor and an advocate for men's health. William Langford has been with PepsiCo for 20 years and is currently Vice President of National Accounts for Frito-Lay. He also serves as the executive sponsor of the Plano Mosaic Chapter, PepsiCo's employee resource group dedicated to supporting the growth of Black associates. William is the executive sponsor of the Michigan State University recruiting team and a proud husband, father, and member of Kappa Alpha Psi fraternity. Nak Vaughn is a senior studying psychology, public health, and economics at Wichita State University. An aspiring researcher and public servant, Nak is conducting a research project on systems-level factors that affect integrated behavioral health care, mental health parity, and social determinants of health in Kansas. He is a member of the Canvas Advocacy Committee for the American Heart Association and was a 2020 Empowered to Serve Scholar. Dr. Ana Sierra is a licensed professional counselor and serves the DC metro area. She has worked with children, adults, and adolescents from outpatient, residential, and home community environments. She has specifically worked with those who experience post-traumatic stress disorder, depression, anxiety, behavioral challenges, chronic mental illness, and complex trauma. Welcome to each of you. And now I will turn the program over to you, Dr. Sharma. Take it away. And Dr. Sharma, you're on mute, by the way. Sorry.
Good evening. It is an honor to be part of this important conversation. Errol, we have brought together an excellent panel to discuss the importance of men's health and well-being, especially as we start to reemerge from this pandemic. Let us get started. The past year has been very extremely difficult with the pandemic, social injustice that we have been experiencing in this country. How have you been impacted the past year as you strived to balance work, family, and a new normal? Matthew, will you start by sharing your experience?
Yes, I will. Thank you, Dr. Sharma. And thank American Heart Association and my friend, Nancy Brown, who I've known for 20 plus years, for bringing us all together to share and to just acknowledge the need that men, we have to do better when it comes to health. For me, COVID was a wake-up call. Almost 2 years ago, I was diagnosed with cancer. Male chest cancer, which is another name for breast cancer, very rare diagnosed for men. But during the COVID, I went through this whole mental stress. I had this fear of dying to the point that I called my therapist. Yes, I do have a therapist. And I called him and I said, what is wrong with me? I don't want to go outside. I don't want to touch anything. I don't want my wife to go outside. I'm just over exaggerating. And he shared with me that whatever we brought to COVID, we brought anger, hatred, love, whatever it was, or fear, that it was multiplied 25 times. I never got over my fear of dying once I was diagnosed of male chest cancer. And I had to come to grips with that. And through COVID, I always say that through sometimes challenges comes opportunities. Through COVID, I got to really get deep inside and to understand my fear that I had. And I was so happy to hear Ray talk about early diagnosis, because I will say that saved my life. I was fortunate and I'm very grateful. I was diagnosed at stage 1A. But it's all about early detection. And I'm sure myself and many others will talk more about the importance about early detection and understand genetic testing, something that is very dear to me that I'd like to talk to later on during this hour. So thank you very much, Dr. Sharma.
Incredible. Thank you very much, Matthew. William, will you tell us how you have helped not only your family, but also your employees navigating the changes that had to be made when the pandemic hit?
Thank you so much, Dr. Sharma. And I'm just excited to be on this panel as well. I think, when you talk about the family, I'm married and I have three children, and two of them are adults and one of them is a sophomore in college. And I think what my wife and I decided to do is really have conversations with each of them on how COVID was impacting them and how they were actually feeling. I think, oftentimes as men, we're accused of not talking about how we're feeling or not addressing each other's feelings. But, from my older daughter who is, in a professional career, her sort of wondering how COVID might affect her career, to my youngest son who had to come home from school, who was living on campus and had to come home and, missed the majority of his on-campus time at home because of COVID. So it was really important for us to really stay connected with our children, to understand what they were going through, and to also offer support that we can offer as a family. But if they needed additional help, providing ways for them to get that additional help, as Dr. Knowles talked about, even if that was through therapy, because what we cared about was their ultimate health. In terms of employees, very different, because if you think about employees, they clearly, from a personal perspective, they all have different situations. And you have employees that were, that may be single, that are living at home and have very little interaction now that they are quarantined and in COVID and still have to operate and do their work, from families who have children and are now trying to balance how they're going to take care of the kids and how they're going to work as well. So it was really individual conversations with my employees about what they needed during this time to be successful. And that, whether that meant adjusting the schedule appropriately in terms of what times we were going to start meetings, ensuring that we ended the days at appropriate times so they can go take care of their kids, or in some cases, working with some employees where a couple employees said, hey, I need between, noon and 2, do this with my family. It will make my situation much better. And then I'll get back on in the evening. So just understanding how to be really intentional about understanding what our employees and our families needed was something that we took on as very important as we managed through this.
Thank you. That's very good information, William. Now, as a college student, away from your family, what has been your experience like?
Thank you, Dr. Sharma, and thank you, HJ. It's been a roller coaster. My dad, he got COVID last November, shortly before Thanksgiving. He's in his late 60s and he has diabetes. So to say that I was very worried would be an understatement. Dad was bedridden for a few weeks, but thankfully it never got bad to the point where he had to be hospitalized. This pandemic affected all aspects of our lives. Dad, he got laid off. I lost my health insurance, actually trying to find health insurance right now. But anyways, the nonprofit I worked for, they experienced a major budgetary shortfall. And so they're trying to find a way to ensure I get paid from July to August to September. And there definitely was, this racial aspect as well. Stranger actually verbally lashed out at my sister and her boyfriend when they're out shopping. A lot of the folks in my family, especially aunts, and grandma, they were concerned that they would be attacked for their race. And the stories I shared just now, certainly not unique by any means. This is reality for many folks of color now, but hopefully it doesn't have to be the fate. But even then, I focused a lot on kind of like the negatives, downhills. But there was a lot for me to appreciate. Since this pandemic, I developed a much closer relationship with my family. Saved a lot of money on gas and transportation. Even got a dog and picked up biking as a hobby. But perhaps even more relevant to this conversation, my career and my calling to advocate and to advance health equity and justice, it became even more pronounced since this pandemic.
Thank you for sharing. As more people are getting vaccinated and we are emerging from this world, we are still seeing social injustice and racism. Most recently towards our Asian American brothers and Pacific Islanders and sisters. This takes a toll not only on our physical health, but also on our mental health. We know that managing health can be difficult to some Americans. There are people across every community who are forced to make trade-offs between paying rent and purchasing medications, healthy food, and medical care. Anna, I want to start with you. Seeking mental health support can be difficult, and men may be even more hesitant to come forward. What advice or words of wisdom would you share with those hesitant to seek help or need resources to manage their stress and mental health? Anna?
Absolutely. Thank you so much for having me here today. It's really an honor to share the panel with such amazing men that are leading the community right now by their presence. We know as mental health professionals that men, especially men of color, grow up in societies, cultures that make it almost impossible for them to know and learn how to ask for help from early childhood. Because when something happens to them, they're socialized to be tough, right? To don't cry, boys don't cry, or if you fall, well, just dust it off and move on. So their feelings are invalidated, their needs are not validated throughout some of their experiences. So men don't know how to ask for help. That is one of the barriers that we have as in the mental health field. Not that they can't know rationally, but emotionally, it is a very huge task to do. It's very heavy because then that might indicate to that man that they're weak or that they shouldn't have to ask anyone for help if they can handle things themselves. So that pressure keeps men resistant, and we know that in our field. I would encourage men that everything that you learned in childhood, everything that you know about what it's like to be a man or what a man should be like, may not be all the information that you didn't get all the information. So look at us as consultants, right? You hire accountants to do your taxes. You hire a doctor to cure your illnesses. Hire a therapist to be able to work with you collaboratively and get you to a place that will help you reach your best potential according to your terms. This is the most courageous thing that men can do. And actually, it is the most courageous thing. Not being vulnerable takes years of practice, takes years of being able to let the walls down and let people see you for the things that you are carrying inside. I would just say, look at us as consultants for your emotional well-being, because you do deserve it. And for people who are around men, I would challenge you to look at the men in your family, in your community, and begin having conversations about how we can make it safer as communities, as families, as societies, that men are actually could actually come forward and know how to ask for help, because they have people that support them and love them around them.
These are excellent points, Anna. Matthew, when you received your health diagnosis, how did you manage and navigate the process? What support system did you have in place to help you?
Great question. 10 years ago, I was taking 17 different medications, 17. And then male chest cancer 2 years ago. It meant that I had to change my lifestyle. I had all of the precursors: high blood pressure, check. Family history, check. Pre-diabetic, check. Obesity, check. Obviously, I can't change family history, but I could change the others. And it meant for me a rigorous program of fitness. Proud to say I lost 30 pounds. I changed completely my diet. I stopped drinking alcohol totally. And through exercise and routinely seeing a therapist, talking to my therapist, it changed my life. I'm proud to say that I'm not pre-diabetic. I'm proud to say that I'm not obese. And I think that's what is very important, is that we ask ourselves, why has this been placed in our path, and what am I supposed to learn? And that's what I learned, was that I had to make total changes in my lifestyle. And I was willing to do that.
That's a great story. I'm so impressed. And I'm very proud of you, Matthew. The kind of changes you brought on and try to control your lifestyle And that goes a long way in terms of prevention. And I'm a big fan of prevention, and that is something to share, wonderful story to share with everybody else. Now, what would you like to share about managing your health as a young adult in the college setting with a focus on the mental wellness? Now,
Definitely. When it comes to managing our health, I think we, as men especially, we can be too hard on ourselves, too critical ourselves when we're too critical of ourselves. Exercise and nutrition oftentimes become a burden that we feel guilty about. Instead of becoming a hobby or even a lifestyle that we truly enjoy. And those feelings of guilt can prevent us from taking part in those healthy behaviors that help us to improve our well-being in the first place. And I think we can all agree it's especially important to eat healthy, exercise regularly, get enough sleep, and also avoid drugs and alcohol and other risky behaviors. That's probably not what you wanted to hear from me today, though. But instead, I'm gonna say that you're not alone. You're definitely not alone in this journey of improving and managing your health and well-being. To feel connected to yourself by engaging in self-reflection and decompressing from the stressors of day-to-day life, and also to feel connected with your loved ones and your community by being intentional in how you spend time with them, and even more so than being a support system and finding a support system. Being a solidarity system and finding a solidarity system, because in the end, we're all in this together. From communities of color, especially, social connection is it's of the utmost importance. It helps us to perceive a more complete picture of who we are, where we've been, where we're going, how we think, how we feel. And it also helps us realize that your health, my health, our health, the health of our loved ones, and ultimately our communities, it's all interconnected.
very good. Now, I'm very impressed the amount of wisdom you are sharing at such a young age. But I'm serious. I'm very, very impressed by your knowledge and by your thought process. Thank you for sharing that insight. It is never too early to start thinking about your health. And college is the first time many young people are primarily responsible for their well-being, while they are also learning how to manage different aspects of life. So that is a very crucial time, and it's very difficult to navigate both these lifestyles at such a crucial time in a very vulnerable part of your life. So you did very well. William, what role should the workplace play in helping their employees manage their health? Are there any resources, programs that company can provide to help? Can you shed some light on that, William?
Yeah. So thank you for the question. First of all, I believe that companies have a tremendous responsibility in helping their employees manage their health, both mental and physical. Employees are most corporations or all corporations' greatest asset. So if the corporations aren't helping the employees to take care of themselves, it's difficult for those employees to bring their best selves to work. And so I believe that corporations have a tremendous responsibility. And as you talked about ways, there are clearly very basic ways when you think about providing adequate health insurance and support, but even beyond that, programs that help employees get to better lifestyles, whether that's smoking cessation, whether that's diet programs, exercise programs, as Dr. Knowles talked about, whether that's having a culture where you can have healthy living challenges that reward and encourage and make visible steps that people are taking towards living better lifestyles. Because clearly, the better off people are from a mental and health perspective, the better employees they're going to be, the better family members they're going to be, the better brothers, sisters, uncles, fathers they're going to be. And people spend so much time at work to get that positive encouragement and that positive reinforcement to live healthy is something that I believe all corporations bear. Now, from a perspective of mental, there's of course programs like employee assistance programs where corporations can offer employees the opportunity to seek counseling by obviously therapists. That clearly the corporation can make those resources available, just like they make doctors and dentists available. So, but the other things that I think have become really important are, the social aspect. Like we talked a lot about the social unrest that we went through this summer and continue to go through, frankly. I think corporations have a responsibility to create environments where employees can feel safe about having those discussions on what truly is bothering them. Again, as a Black male, I have two Black male sons. So when you think about the racial issues that obviously were brought to it by George Floyd, but also continue to happen, that is something for me, it's very difficult for me when I step into the workplace not to be thinking about those things. So I believe corporations have a responsibility to create environments where employees can have courageous conversations, where employees can voice their concerns, where employees can actually help others understand some of the issues that they may be facing, whether it's issues that were faced in the Asian community here recently. I think corporations have a wonderful setting in order to bring employees together and educate the workforce on these issues. So clearly they can create better workforces, but also they can create empathy with those employees when they go back to their own community. So I believe corporations have a significant impact on mental, physical, as well as the social well-being of their employees.
Absolutely, William, I very much agree with you. We don't have lives in our silos, We have to have a holistic and kind of a attitude, whether we are at home or whether we are at work. The lifestyle issues and the pro-social and pro-health, behavior should continue. So it's a continuum from a cardiovascular standpoint to have the same environment at home, at workplace, or off workplace. But thanks for sharing that insights. Healthcare is closely related to employment in the United States due to insurance coverage. So I think it is important for companies to help their employment manage their health and well-being. This brings us to our final topic for this evening. So the final discussion is about women in our lives typically take the lead in helping manage our healthcare and take on the responsibilities of the health and well-being of the family. And it's a lot of burden on our spouses. Everyone is talking about reestablishing a new normal post-pandemic. What advice would you have for the men listening and the women who love them on how they can take charge of the health and make it now normal moving forward? Matthew, let me start with you first.
Okay. I think it's very important, Dr. Sharma. We touched on it briefly in the very beginning of tonight, that we understand when we look at Black men and men of color, we lead in every category of mortality other than breast cancer and suicide. When we look percentage-wise for the population, think about that in every category. So what that tells us is that there's a rude awakening for men of color. We have to understand the risk that is in front of us and how do we prevent it? It's early detection. I have an advantage that for 20 years, I worked in diagnostic imaging. So I know the importance of early detection. I know my doctor, whenever I call, is like, oh, there he is again. I understand. I think it's important also that we understand it's a changing medical field, that we all have a say. We all can have a voice in our medical, the way that we treat our personal medical conditions. We have a say in that today. We have patient rights. And I just think it's important first that men understand that. I'm not sure most men understand the amount of risk that we're at. And so I think it starts there. It starts all the many, and I touched on what is fascinating to me and what I learned through my experience of male chest cancer is genetic testing. And it's a saliva test, and it's for cardiovascular testing. It's for cancer. You can actually take a test, they'll ship it to you, and find out if you're at higher risk. I tell you, if I had known that I could have taken a saliva test, and I pride myself on thinking I know. I didn't know about genetic testing. That would have really changed my path. So I encourage all of you to consider genetic testing to see if you're at higher risk and understand your family history. And for women, we simply can't do this without you. Just like we need you for everything else in life, we really need you for this. We need you to encourage us. We need you to get our attention, and ladies, you know how to get our attention. To say, hey, you need to go and get an exam, and you need to do it now. And so that's what I think it is. It's about information. It's about knowledge. It's about encouragement, and it's about having a team approach to medicine and about early diagnosis and detection.
Excellent, excellent. You just read my mind. As a cardiologist, the prevention is the key. And the prevention is also has to be very early. And if you start out early, find your risk profile, take the necessary steps in your lifestyle, you're already ahead of the game. So you cannot be put more beautifully. Now let me turn to William. William, what are your thoughts on it?
I just think it's, when you think about your well-being, right? I mean, I've heard this saying many times that, you can't pour from an empty cup. And as men, there are a lot of people that are counting on us, right? From our families, from our communities, to our, people that we mentor, our churches, our companies, right? So there's a lot of people that depend on us. And I think that, when you think about this notion of not pouring from an empty cup, that means that we have to be in good shape. We have to be in good enough shape in order to give back and help our communities and help our families. So when I think about it, I think about this notion of it being active, right? Not passive, right? I don't think we can manage our mental and physical well-being from a passive perspective. I think we have to be really active in understanding, are we managing our diet appropriately? Checking in with ourselves to understand how we are feeling mentally. Are we exercising appropriately? Are we taking our care of ourselves spiritually, whatever that might be for you, whether that's religion or meditation or whatever that may be, but are we truly taking care of ourselves so that we can support and take care of others? And I think that, in order to do that, you can't sit by and wait for something to happen. As so many folks on the panel have said, this early detection, right? You can't sit by and wait for something to happen before you choose to have a life change. So I believe if you're more actively and you're really intentional about the choices that you're making and how you're living a better life from a mental, physical, and spiritual perspective, I think that has to be something that's in your daily, monthly, yearly regimen. And there has to be some sort of conviction about understanding where you are against all those things and what it's going to take you in order to get better. And I think, knowing that is really important, but it's this whole notion of being very intentional about it, just like we're intentional about, a lot of other steps that we may be taking in our lives, right? About how, intentional, I got to get up and go to work in the morning, right? It's intentionally being focused on our well-being. And I think, when you think about the women in our lives, whether that's mother, sister, aunt, wife, clearly, they are depending upon us to do that. And they are more than glad to help. And I think we have to help them. Sometimes we could be a little hard-headed, but these women in our lives, they're trying to help us. And I think it's important that we listen. and that we listen appropriately, and because they're clearly doing it out of the love that they have for us. So, that's what I would offer. It is this notion of being actively managing your health and your well-being and being really intentional about it.
That's very true. I always tell my patients in the cardiovascular clinic, that you have to be your own advocate. We have a lot of support system. We have a safety net, we have doctors, we have hospitals, but unless you are involved, unless you are motivated, unless you are the part of the process, it cannot get better than that. You got to be more proactive and more advocate for your own things. And coming to the spouses and our families, I always ask the spouse, how are you doing? Because many times what they tell us in the clinic and what they behave at home is totally different. So that also makes it very important that we talk to our spouses, and sometimes the spouses run the show, they know the medications and all that. So it's a part of a whole thing. Everything is connected. It takes a village to take care of us. Let me go to Nak. Nak, what is your take on this concept as a family care, as a family, as a unit, especially the role of spouses or the girlfriends, whatever the case may be in our healthcare?
No. This is advice that I'm learning myself. So, Dr. Matthew and William and Dr. Sierra, what you all have said so far, I'm taking it to heart personally. But just from my perspective, in terms of managing my own health, but also kind of realizing that it's a two-way street, and that how I my actions can affect the health of my loved ones, and vice versa. And so once again, it's a team approach. But anyways, from my perspective, advice that's really helped me in terms of better managing my health is to identify and hold with intentionality that why, that purpose for why we want to improve our health behaviors in the first place. More specifically, when it comes to diet or exercise or self-care, am I doing it for intrinsic reasons, or am I doing it for external reasons, extrinsic reasons? That is to say, for appearances or for rewards. My health goals, are they tied to who I am on the inside, my core values, or are they tied to just something that I think society or others are expecting of me? And I'll borrow a bit from the self-determination theory, and ask you guys these three questions. Ask our audience these three questions. So, to what extent do you feel ownership of your health? To what extent do you feel connected to your health? And to what extent do you feel competent in your ability to improve your health? And I think those three questions, it goes down to our, at the core of it, our most basic psychological needs, our autonomy, our relatedness, our competence. And so ultimately, for us to be able to improve our health and well-being, and for us to be able to better support our loved ones' health and well-being, we have to have that motivation and that drive and that feelings of empowerment to do so.
Excellent. As a cardiovascular physician, we know now that the cardiovascular diseases, especially atherosclerosis, does not start in 50s or 60s. Atherosclerosis, or the hardening of the arteries, starts very, very early, even 20s and 30s. So the sooner you start, the better it is. One comment I want to make about the men, and again, I don't want to be sexist, but in my 30 years of experience, I have noticed that when men come to me with their cardiovascular problems, more often than not, they will minimize, they will hide, they will not discuss, they will try to tune me out, not give me the whole picture. So I have already made a point in my practice to reach out to the spouse, bring them in the room or call them to get the whole picture. And I think that is also sometimes becomes a barrier to care. We should be open with our physicians. We should tell exactly what is going on. And that's where women have a special role. The women in our life have a special role to bring it out, to tell the truth, and to be our advocate also at the same time. So on that point, I'll come to Anna. Anna, what is your advice to all of us in terms of what have you learned and what can you share as the role of women in the overall care of the not only the family, but men in particular?
Well, I do want to piggyback off what you just said about why perhaps men of color have a difficult time being 100% open, even with mental health providers when they come to therapy for the first time. There's a lot of guardedness, but that's not because they choose that in that moment. It's a response, right? Remember that men of color have had to deal with systems from early childhood, from school that discriminate, racism. So systems are not safe places for them, right? So it is kind of like a subconscious impulse that does not allow that openness, right? So it's not something that they're doing unconsciously, right? It is a way of defending something that's been hurt many times from the time they are very little. So we know that even the stress of chronic racism and discrimination shortens people of color's lives, right? And increases the chances of health conditions. And there are many studies about that. I know Ray shared about whether that stressful event impacted his health. I would say that was probably the last drop he could tolerate, because there's many other things that men have to deal with, pressures, not knowing how to process these emotions. But I would say that we have to be a little bit easier on men and understand why they do what they do in our settings, right? So why, when a man comes to see me in therapy, tells me straight up, I don't want you to see me crying. And I'm like, okay, we don't have to go there today. And understand why they do that. It's not on purpose, and it's an impulse. It's kind of like a reflex. That can go away with trust building. I would say that for the men, and someone mentioned this, that men lead in many areas of our lives, right? As in communities and families. And I would challenge men to lead on the conversation within your own circles of men about therapy, about seeking, being strong enough and courageous enough to get your emotional consultant, because the research also shows that men listen to men more than women, right? It's just what research shows too. It is what it is. Like, that's what I tell my families. I would also say that men would seek out therapists and providers that actually feel safer. So people that understand working with people, community of color, people that understand how men work, and specialty on how to work with men. There are therapists specialized on that. Not every therapist will be the thing for you, right? You could go through 10 therapists and none of them click for you, but you have to really go ahead and do your research. There's a lot of directories out there for people of color. There's Latinx therapy for Latinx, Black Men Heal. There's others that you can filter, people that look like us, if that's what you feel comfortable with. And then in the space, it will feel a little bit different, safer, right? Or, but still, don't be easy on yourself, because it is hard to like put your guard down, because that guard has saved you many times emotionally, right? So in all systems, that's going to be there, right? When you go to especially seeing these events that we have seen in the past year, if not just the past year, historically, right? We have seen communities of color hurt by systems. And that is something that cannot be just forgotten or cannot be put aside so that we can move on with, whatever's going on in front of us. I would challenge men to just lead these conversations in your circles, because you really hold that power with your peers, with your male, and you're within those male circles. And you could be the one person that shifts that conversation and begin to reconstruct what it's like to be, what are the values of a man, and what do I identify as manhood. And that is only things that men listen to other men, and that's just what happens in therapy. But I would also encourage you to do that. Just take take the lead on this, because you have the power, the spaces, and you have the abilities to do it. Get your emotional consultant. We're here for you. And we know the struggles you're going through. So we know that when you come in, how to help you through that.
Thank you, Anna. You're right. Sometimes we see studies and the role of barber in convincing men of color to take the pills or be compliant or go to the doctor. So you're right. We have to get help from wherever we can get, and also keep the cultural sensitivities in our mind. As a physician of South Asian origin, of Indian background, I can tell you many Indians who come from India in their old age, they will not talk. They will not go to any other doctor because of language barriers or culture barriers. And they try to seek their own physicians who are maybe far away. So there is also something like that. They want to look for their own people who can talk, who can understand their accent, and who can understand their diet. So there's a lot about that thing, but it was excellent discussion. As time comes close to an end tonight, I would like to thank our excellent panel for sharing their stories and wisdom with us. This was a timely discussion, to say the least, as we are starting to come out of the pandemic. I encourage all of you to take some time and plan for taking control of your health, of course, physical, mental, and spiritual. You can find additional resources to help you to get back to the doctor and reprioritize your health at heart. Heart.org, call your doctor. Daryl, I'll turn this back over to you to close this session out. Thank you.
Thank you so much, Dr. Sharma. Thank you for moderating this extraordinary conversation. I also want to say thank you to each of our panelists. Your influence, knowledge, and drive to make the lives of those you touch and your communities healthier is so crucial to the work we do. The American Heart Association's mission is to be a relentless force for a world of longer, healthier lives. Our mission would not be realized as long as health disparities and social injustice continue to exist. We must continue to speak up, act, and advocate for our communities. With that, next month is National Black Family Month, and we invite you to join us on July 27th for the Empowered Men's Roundtable that will look at the role men play in the health of their families. To learn more about how you can be a part of the Empowered Initiative, please visit www.empoweredtoserve.org. Thank you again and have a great evening. Good night, everyone.
Thank you.